Edutainment Studios welcomes you to Pre-Pregnancy Planning, Healthy Pregnancy. This module is part 3 of a 4-part series on pre-pregnancy planning. Having a healthy pregnancy begins before you actually get pregnant. This module can help you work on becoming as mentally and physically healthy as possible before you start trying to get pregnant. This increases your chances of getting pregnant and having a healthy delivery and baby. In this course, the objective is to help you demonstrate the importance of breaking any unhealthy habits. It is easier for you and safer for your baby if any unhealthy habits are broken before getting pregnant. If you smoke while you are pregnant, the dangerous chemicals like tar, nicotine, and carbon monoxide will reach the baby. Also, nicotine narrows the blood vessels, so less nutrients and oxygen get to the baby. For these reasons, smoking during pregnancy can cause miscarriage, bleeding, low birth weight, and an early birth. After birth, the baby has an increased risk of sudden infant death syndrome or SIDS, asthma, colic, and childhood obesity. Ask for help on trying to quit smoking for good. You can also visit www.smokefree.gov or call 1-800-QUIT-NOW for tools to help quit. Any alcohol that is consumed while pregnant also reaches the baby, but the baby's liver cannot break down the alcohol. The different effects that drinking during pregnancy can have on a baby are called fetal alcohol spectrum disorders. These effects include physical, mental, behavioral, and learning disabilities that can last their entire life. The most serious of these is fetal alcohol syndrome, or FAS. It causes abnormal facial features, slow growth, and mental conditions. The risk for FAS is at its highest when you drink heavily throughout your pregnancy. Although even as little as 1 drink a day can cause the child to have learning or behavioral problems. Taking illegal drugs or abusing prescription medication while being pregnant can cause miscarriages and birth defects. It also can affect the baby's growth and lead to premature birth. If you are addicted to a drug, your baby may also be born addicted to that drug and can suffer physical withdrawal symptoms after birth. Getting treatment for addiction before getting pregnant is important for your health as well as your baby's. You can confide in and lean on your doctor to help find the best course of treatment. It can be hard to open up about drug use, but the doctor is there to help you, not to judge you. There are several reasons to curb your caffeine intake or avoid it altogether. Too much caffeine can make it harder to get pregnant and can increase your risk of miscarriage. It can increase blood pressure, heart rate, and the need to urinate, which can lead to dehydration. These changes in your body are not healthy for the baby. The baby's undeveloped body cannot process caffeine the same way an adult body can. If you cannot cut out caffeine completely, then ask the doctor what a safe amount would be for you to consume. In general, one should drink less than 200 milligrams a day, or about 1 12-ounce cup of coffee. When you are pregnant, breathing in secondhand smoke and pesticides passes these chemicals along to your baby. Being around secondhand smoke can cause miscarriage, birth defects, low birth weight, and other health conditions. Chemicals in pesticides can harm the baby's nervous system as well. It is not safe for a pregnant mother to be in a hot tub, especially during the first 3 months of pregnancy. The heat from a hot tub can be dangerous for the baby, as it may raise their internal temperature and he or she cannot sweat in order to cool down. Please feel free to investigate these sites and others for more information, and remember to bring any concerns or questions in to discuss with your doctor. Thank you for joining us today for part 3 of this 4-part series on pre-pregnancy planning. And please join us for part 4.